A client is receiving tacrolimus to prevent organ rejection. Which is a nursing consideration associated with this medication? 1. Give with cyclosporin. 2. Assess for hypoglycemia. 3. Give with grapefruit juice. 4. Assess platelet count for thrombocytopenia. Answer. 4. Assess platelet count for thrombocytopenia. Rationale. Tacrolimus is an immunosuppressant and is an alternative to cyclosporin for prevention of organ rejection in clients receiving an organ transplant. It should never be given with cyclosporin because of its toxic effects on the kidney. This medication will cause hyperglycemia, not hypoglycemia. Grapefruit juice can increase tacrolimus levels, so it should be avoided to prevent toxicity. Tacrolimus suppresses the bone marrow, so it can cause anemia, thrombocytopenia, and neutropenia. 2. The nurse is caring for a client who is taking a maintenance dosage of lithium carbonate. What nursing action should be included in the client's plan of care? 1. Monitoring intake and output. 2. Reviewing daily serum lithium levels. 3. Performing a weekly electrocardiogram. 4. Observing for remission of a depressive state. Answer. 1. Monitoring intake and output. Rationale. This medication is very dependent on stable body fluid levels, and so monitoring daily intake and output is critical. Lithium is used to treat manic disorders, not depression. Side adverse effects of lithium are nausea, tremors, polyuria, and polydipsia. Serum lithium concentration is assessed approximately every 2 to 4 days during initial therapy and at longer intervals thereafter. Toxic levels of lithium may induce electrocardiogram changes. However, performing weekly ECGs is unnecessary if therapeutic levels are maintained. 3. The nurse has provided instructions to a client receiving enalapril maleate for hypertension. Which statement by the client indicates a need for further instruction? 1. I need to rise slowly from a lying to a sitting position. 2. I need to notify the primary healthcare provider if fatigue occurs. 3. I need to notify the primary healthcare provider if a sore throat occurs. 4. I know that several weeks of therapy may be required for the full therapeutic effect. Answer. 2. I need to notify the primary healthcare provider if fatigue occurs. Rationale. To reduce the hypotensive effect of this medication, the client is instructed to rise slowly from a lying to a sitting position and to permit the legs to dangle from the bed momentarily before standing. If fatigue occurs, it is not necessary to notify the primary healthcare provider, PHCP. The client is encouraged to pace activities. The client should report signs of a sore throat or fever to the PHCP because these may indicate infection. The client should be notified that several weeks may be needed for the full therapeutic effect of blood pressure reduction. The client also should be instructed not to skip doses or discontinue the medication because severe rebound hypertension could occur. 4. The nurse reads that metoclopramide is prescribed for a client. Based on this prescription, the nurse expects to note that which diagnosis is documented. 1. Asthma. 2. Gastroparesis. 3. Allergic rhinitis. 4. Chronic kidney disease. Answer. 2. Gastroparesis. Rationale. Metoclopramide stimulates motility of the upper gastrointestinal tract. It is used to stimulate gastric emptying for the treatment of gastroparesis and to treat gastroesophageal reflux disease. It may also be prescribed to relieve nausea and vomiting. It is not a respiratory medication or a renal urinary medication and is not used to treat the conditions noted in the incorrect options. 5. The nurse prepares to teach a client with subarachnoid hemorrhage about the effects of nimodipine. The nurse plans to explain which information about the type and action of this medication. 1. Vasodilator that has an affinity for cerebral blood vessels. 2. Beta-adrenergic blocker that will decrease blood pressure. 3. Diuretic that will decrease blood pressure by decreasing fluid volume. 4. Calcium channel blocker that will decrease spasm in cerebral blood vessels. Answer. 4. Calcium channel blocker that will decrease spasm in cerebral blood vessels. Rationale. Nimodipine is a calcium channel blocking agent that has an affinity for cerebral blood vessels. It is used to prevent or control vasospasm in cerebral blood vessels, thereby reducing the chance for rebleeding. It is typically prescribed for 3 weeks duration. 6. The nurse is providing instructions to the client newly diagnosed with diabetes mellitus who has been prescribed pramlintide. Which instruction should the nurse include in the discharge teaching? 1. Take your prescribed pills 1 hour before or 2 hours after the injection. 2. Inject the pramlintide at the same time you take your other medications. 3. Be sure to take the pramlintide with food so you don't upset your stomach. 4. Make sure you take your pramlintide immediately after you eat so you don't experience a low blood sugar. Answer. 1. Take your prescribed pills 1 hour before or 2 hours after the injection. Rationale. Pramlintide is used for clients with types 1 and 2 diabetes mellitus who use insulin. It is administered subcutaneously before meals to lower blood glucose level after meals, leading to less fluctuation during the day and better long-term glucose control. Because pramlintide delays gastric emptying, oral medications should be given 1 hour before or 2 hours after an injection of pramlintide. Therefore, instructing the client to take his or her pills 1 hour before or 2 hours after the injection is correct. Pramlintide should not be taken at the same time as other medications. Pramlintide is given immediately before the meal in order to control postprandial rise in blood glucose, not necessarily to prevent stomach upset. It is incorrect to instruct the client to take the medication after eating, as it will not achieve its full therapeutic effect. 7. The nurse is educating a client about medroxyprogesterone. The nurse should provide the client with which information about the medication? 1. Should be taken once daily by mouth. 2. Should be administered intramuscularly every 3 months. 3. Should be taken immediately following sexual intercourse. 4. Provides some protection against sexually transmitted infections. Answer. 2. Should be administered intramuscularly every 3 months. Rationale. Medroxyprogesterone is given intramuscularly in the deltoid or gluteus maximus muscle. Injections should be administered every 12 weeks. Advantages of medroxyprogesterone include contraceptive effectiveness comparable to combined oral contraceptives and long-lasting effects. Additionally, injections are required only 4 times a year. Disadvantages are prolonged amenorrhea or uterine bleeding, increased risk of venous thrombosis and thromboembolism, and no protection against sexually transmitted infections. The nurse is preparing to administer phytonadione to the client. Which laboratory value should the nurse monitor in order to evaluate the effectiveness of the medication? 1. Prothrombin time. 2. Blood ammonia level. 3. Direct serum bilirubin. 4. Serum potassium level. Answer. 1. Prothrombin time. Rationale. Phytonadione is needed for adequate blood clotting. Therefore, checking the prothrombin time is necessary 24 hours after injection of this medication. Blood ammonia levels are assessed to determine the conversion of ammonia to urea that normally occurs in the liver. Bilirubin is a measurement of the ability of the liver to conjugate and excrete bilirubin. Serum potassium is an electrolyte and is not affected by the injection of phytonadione. 9. A client with psoriasis is being treated with calcipotriene cream. Administration of high doses of this medication can cause which side or adverse effect? 1. Alopecia 2. Hyperkalemia 3. Hypercalcemia 4. Thinning of the skin. Answer. 3. Hypercalcemia. Rationale. Calcipotriene, an analog of vitamin D3, is indicated for mild to moderate psoriasis. Responses are equal to those achieved with medium-potency topical glucocorticoids. The most common adverse effect is local irritation. Unlike glucocorticoids, calcipotriene does not cause thinning of the skin. At high doses, calcipotriene has caused hypercalcemia. Alopecia and hyperkalemia are not associated with this medication. 10. The nurse is caring for a postpartum client with a diagnosis of deep vein thrombosis who is receiving a continuous intravenous infusion of heparin sodium. Review of which laboratory result is the most important by the nurse. 1. Platelet count. 2. Prothrombin time, PT. 3. International Normalized Ratio, INR. 4. Activated partial thromboplastin time, APTT. Answer. 4. Activated partial thromboplastin time, APTT. Rationale. Anticoagulation therapy may be used to prevent the extension of thrombus by delaying the clotting time of the blood. The APTT time should be monitored, and the heparin sodium dose should be adjusted to maintain a therapeutic level of 1.5 to 2.5 times the control value in seconds. The platelet count cannot be used to determine an adequate dosage for the heparin sodium infusion. The PT and the INR are used to monitor coagulation time when warfarin sodium is used. 11. The client delivered a newborn baby 3 hours ago. The assigned nurse is reviewing the electronic health record to determine if the new mother is a candidate for Rh immune globulin administration. Which criteria must be present to determine that the client needs the medication? Select all that apply. 1. The father must be Rh negative. 2. The mother must be Rh negative. 3. The newborn must be Rh positive. 4. The indirect Coombs test must be negative. 5. The newborn must be a second or subsequent child delivered to this mother. Answer. 2. The mother must be Rh negative. 3. The newborn must be Rh positive. 4. The indirect Coombs test must be negative. Rationale. Following the birth of a first child, if eligible, the mother should receive Rh immune globulin as a protection against the development of Rh immunization in her next child. To be a candidate, the mother must be Rh negative. The newborn must be Rh positive, and the father must be Rh positive. The indirect Coombs test should be negative and not contain any Rh antibodies. 12. The nurse is evaluating the serum acetylsalicylic acid results for a client receiving acetylsalicylic acid for rheumatoid arthritis. Which noted result is indicative that the client is within the range for the medication's antiarthritic effect? 1. 10 mg per deciliter, 0.72 mmol, L2. 18 mg per deciliter, 1.31 mmol, L3. 26 mg per deciliter, 1.88 mmol, L4. 38 mg per deciliter, 2.75 mmol, L. Answer. 3. 26 mg per deciliter, 1.88 mmol, L. Rationale. Acetylsalicylic acid is a nonsteroidal agent that is prescribed for its anti-inflammatory, antipyretic, and anticoagulant properties. Serum blood levels may be determined periodically to assess for an effective antiarthritic effect in the client with rheumatoid arthritis. The therapeutic serum level for an antiarthritic effect is between 20 and 30 mg per deciliter, 1.45 and 2.17 mmol/L. Toxicity occurs if levels are greater than 30 mg per deciliter, 2.17 mmol/L. The nurse is providing discharge instructions to a client receiving trimethoprim sulfamethoxazole. Which instruction should be included in the list? 1. Advise that sunscreen is not needed. 2. Drink 8 to 10 glasses of water per day. 3. Decrease the dosage when symptoms are improving to prevent an allergic response. 4. If the urine turns dark brown, call the primary health care provider, PHCP, immediately. Answer. 2. Drink 8 to 10 glasses of water per day. Rationale. Each dose of trimethoprim sulfamethoxazole should be administered with a full glass of water, and the client should maintain a high fluid intake to avoid crystalluria. The medication is more soluble in alkaline urine. The client should not be instructed to taper or discontinue the dose. Clients should be advised to use sunscreen since the skin becomes sensitive to the sun. Some forms of trimethoprim sulfamethoxazole cause urine to turn dark brown or red. This does not indicate the need to notify the PHCP. 14. The client who is seropositive for human immunodeficiency virus, HIV, has been taking ritonavir. The nurse tells the client that which follow-up laboratory study will be necessary while taking this medication. 1. Platelet count. 2. Triglyceride level. 3. Prothrombin time, PT. 4. International Normalized Ratio, INR. Answer. 2. Triglyceride level. Rationale. Ritonavir is an antiretroviral, protease inhibitor, used in combination with other antiretroviral medications in the management of HIV infection. It can increase triglyceride levels, therefore, the client's triglyceride levels should be monitored. The platelet count, PT, and INR are not laboratory tests that would be monitored specifically in the client on this medication. 15. A client with acquired immunodeficiency syndrome who is taking zidovudine 200 mg orally 3 times daily has severe neutropenia noted on follow-up laboratory studies. The nurse interprets that which change is likely to occur at this point. 1. The medication dose probably will be reduced. 2. Prednisone probably will be added to the medication regimen. 3. Epoetin alpha probably will be added to the medication regimen. 4. The medication probably will be discontinued until laboratory results indicate bone marrow recovery. Answer. 4. The medication probably will be discontinued until laboratory results indicate bone marrow recovery. Rationale. Zidovudine is a nucleoside-nucleotide reverse transcriptase inhibitor. Hematological monitoring should be done every 2 weeks in the client taking zidovudine. If severe anemia or severe neutropenia develops, treatment should be discontinued until evidence of bone marrow recovery is noted. If anemia or neutropenia is mild, a reduction in dosage may be sufficient. The administration of prednisone may further alter the immune function. Epoetin alpha is administered to clients experiencing anemia. 16. Rho-D immune globulin is prescribed for a client after delivery, and the nurse provides information to the client about the purpose of the medication. The nurse determines that the woman understands the purpose if the woman states that it will protect her next baby from which condition? 1. having Rh-positive blood 2, developing a rubella infection 3, developing physiological jaundice 4, being affected by Rh incompatibility. Answer. 4. Being affected by Rh incompatibility. Rationale. Rh incompatibility can occur when an Rh-negative mother becomes sensitized to the Rh antigen. Sensitization may develop when an Rh-negative woman becomes pregnant with a fetus who is Rh-positive. During pregnancy and at delivery, some of the fetus's Rh-positive blood can enter the maternal circulation, causing the mother's immune system to form antibodies against Rh-positive blood. Administration of Rho, the immune globulin, prevents the mother from developing antibodies against Rh-positive blood by providing passive antibody protection against the Rh antigen. 17. Acarbose is prescribed to treat a client with type 2 diabetes mellitus. Which instruction should the nurse provide when teaching the client about this medication? 1. Take the medication at bedtime. 2. Take the medication with the first bite of each regular meal. 3. The medication will be used to treat symptoms of hypoglycemia. 4. Headache and dizziness are the most common side effects of this medication. Answer. 2. Take the medication with the first bite of each regular meal. Rationale. Acarbose is an alpha-glucosidase inhibitor. Taken with the first bite of each major meal, acarbose delays absorption of ingested carbohydrates, decreasing postprandial hyperglycemia. It is not taken at bedtime. Abdominal pain and flatulence, not headache and dizziness, are the most common side effects of this medication. 18. An adolescent with severe cystic acne has been prescribed isotretinoin. Which statement by the client would suggest the need for further teaching? 1. I will return to the clinic for blood tests. 2. If my lips begin to burn, it is probably because of the medication. 3. My eyes may become dry and burn as a result of the medication. 4. I need to take my vitamin A supplement so that the treatment will work. Answer. 4. I need to take my vitamin A supplement so that the treatment will work. Rationale. Isotretinoin is used to inhibit inflammation in the client with severe cystic acne. Adverse effects include elevated triglyceride levels, skin dryness, and eye discomfort, such as dryness and burning. Lip inflammation, called cheilitis, can also occur. Vitamin A supplements are stopped during this treatment because of their additive effects. 19. The nurse is instructing a client who is taking levothyroxine and tells the client that full therapeutic benefits will be seen when 1. Immediately. 2. In 1 to 3 weeks. 3. Within 24 hours. 4. Within 3 to 5 days. Answer. 2. In 1 to 3 weeks. Rationale. It takes up to 1 month for plateau levels of levothyroxine to be achieved, so clients must be told that full benefits will not be seen for 1 to 3 weeks. Therefore, the remaining options are incorrect. 20. A client is experiencing impotence after taking guanfacine. The client states, I would sooner have a stroke than keep living with the effects of this medication. What is the most appropriate response by the nurse? 1. I can understand completely. 2. You wouldn't really want to have a stroke. 3. You are concerned about the effects of your medication. 4. The primary healthcare provider should change your prescription. Answer. 3. You are concerned about the effects of your medication. Rationale. Reflection of the client's own comment lets the client know that the nurse hears the concern without judging. The nurse cannot understand what the client is experiencing. To tell the client, you wouldn't really want to have a stroke, is confrontational and unsupportive. The client's prescription may need to be changed, but from the options provided, this is not the most appropriate response. 21. The primary healthcare provider, PHCP, prescribed tetracycline for a 5-year-old pediatric client. The nurse questions this prescription for what reason? 1. It is classified as a narrow-spectrum antibiotic. 2. It is identified as safe for use during pregnancy. 3. It is used to treat a wide variety of disease processes. 4. It is contraindicated in children younger than 8 years of age. Answer. 4. It is contraindicated in children younger than 8 years of age. Rationale. All tetracyclines are contraindicated in children younger than 8 years of age because the medication deposits in bone and teeth enamel and can result in permanent discoloration of developing teeth. Tetracyclines are broad-spectrum antibiotics. Tetracyclines are used to treat specific infections and are contraindicated during pregnancy because of their effects on developing teeth. 22. A client arrives at the clinic complaining of fatigue, lack of energy, constipation, and depression. Hypothyroidism is diagnosed, and levothyroxine is prescribed. What is an expected outcome of the medication? 1. Alleviate depression. 2. Increase energy levels. 3. Increase blood glucose levels. 4. Achieve normal thyroid hormone levels. Answer. 4. Achieve normal thyroid hormone levels. Rationale. Laboratory determinations of the serum thyroid stimulating hormone, TSH, level are an important means of evaluation. Successful therapy causes elevated TSH levels to decline. These levels begin their decline within hours of the onset of therapy and continue to decrease as plasma levels of thyroid hormone build up. If inadequate dosage is administered, TSH levels remain suppressed for the duration of therapy. Although energy levels may increase and the client's mood may improve following effective treatment, these are not noted until normal thyroid hormone levels are achieved with medication therapy. An increase in the blood glucose level is not associated with this condition. 23. A client is being discharged on warfarin sodium, and the nurse provides instructions to the client regarding the medication. Which statement, if made by the client, indicates to the nurse that the client understands the teaching provided? 1. I'll stop my medication if I see bruising. 2. Stiff joints are common while taking warfarin. 3. This medication will prevent me from having a stroke. 4. If I notice blood-tinged urine, I will call the primary healthcare provider. Answer. 4. If I notice blood-tinged urine, I will call the primary healthcare provider. Rationale. Warfarin is an anticoagulant that is used for long-term prophylaxis of thrombosis. Clients must receive detailed instructions on the signs of bleeding. Hematuria is a sign of bleeding, which the client should report. Bruising is a common side effect associated with anticoagulant therapy and is almost unavoidable. The client, however, should not stop the medication if bruising occurs. Stiff joints are unrelated to the use of warfarin, and prevention of a stroke cannot be guaranteed, although risk for thrombotic stroke may be reduced. 24. The nurse is providing education to a client who is being started on atenolol. Which statement by the client indicates that teaching has been effective? 1. I am taking this medication for hypertension. 2. It is to help manage my rheumatoid arthritis. 3. This medication will help my ulcerative colitis. 4. This medication will reverse my second-degree heart block. Answer. 1. I am taking this medication for hypertension. Rationale. Atenolol is a beta-adrenergic blocker that is used as an antihypertensive, antianginal, and antidiuretic. It is used to treat conditions such as hypertension and angina pectoris. It is not used to treat the conditions noted in the other options. In addition, its use is contraindicated in the client with heart block greater than first degree. 25. The nurse is preparing to administer a prescribed dose of cyclosporin by intravenous, IV, administration. Which priority item would the nurse have available during administration of this medication? 1. A code cart. 2. Oral airway. 3. Epinephrine. 4. A suction catheter. Answer. 3. Epinephrine. Rationale. Cyclosporin is an immunosuppressant medication used to prevent rejection following allogeneic organ transplantation. Because of the risk of anaphylaxis during administration of cyclosporin by the IV route, epinephrine and oxygen must be immediately available for use. An oral airway or a suction machine is not the priority item. A code cart should be available, but it is not the priority item. 26. The nurse receives a call from a client concerned about eliminating brown-colored urine after taking nitrofurantoin for a urinary tract infection. The nurse should make which appropriate response? 1. Continue taking the medication. The brown urine occurs and is not harmful. 2. Take magnesium hydroxide with your medication to lighten the urine color. 3. Discontinue taking the medication and make an appointment for a urine culture. 4. Decrease your medication to half the dose because your urine is too concentrated. Answer. 1. Continue taking the medication. The brown urine occurs and is not harmful. Rationale. Nitrofurantoin imparts a harmless brown color to the urine, and the medication should not be discontinued until the prescribed dose is completed. Magnesium hydroxide will not affect urine color. In addition, antacids should be avoided because they interfere with medication effectiveness. 27. A miotic medication has been prescribed for the client with glaucoma, and the client asks the nurse about the purpose of the medication. Which response should the nurse provide to the client? 1. The medication will help dilate the eye to prevent pressure from occurring. 2. The medication will relax the muscles of the eyes and prevent blurred vision. 3. The medication causes the pupil to constrict and will lower the pressure in the eye. 4. The medication will help block the responses that are sent to the muscles in the eye. Answer. 3. The medication causes the pupil to constrict and will lower the pressure in the eye. Rationale. Miotics cause pupillary constriction and are used to treat glaucoma. They lower the intraocular pressure, thereby increasing blood flow to the retina and decreasing retinal damage and loss of vision. Miotics cause a contraction of the ciliary muscle and a widening of the trabecular meshwork. Options 1, 2, and 4 are incorrect. 28. Meperidine has been prescribed for a client to treat pain. Which side and adverse effects should the nurse monitor for? Select all that apply. 1. Diarrhea. 2. Tremors. 3. Drowsiness. 4. Hypotension. 5. Urinary frequency. 6. Increased respiratory rate. Answer. 2. Tremors. 3. Drowsiness. 4. Hypotension. Rationale. Meperidine is an opioid analgesic. Side and adverse effects include respiratory depression, drowsiness, hypotension, constipation, urinary retention, nausea, vomiting, and tremors. Meperidine is not commonly prescribed but may be used for acute pain and as a preoperative medication. 29. The nurse is assisting in the care of a client being discharged on phenytoin 100 mg 3 times daily. When providing client teaching about this medication, the nurse should be sure to include which points. Select all that apply. 1. Break the capsules so they are easier to swallow. 2. Use a soft toothbrush while taking this medication. 3. If a dose is missed, just wait until the next one is due. 4. The medication may turn the urine pink, red, or brown. 5. Alcohol should be avoided while taking this medication. 6. Sore throat is a common side effect of the medication and is nothing to worry about. Answer. 2. Use a soft toothbrush while taking this medication. 4. The medication may turn the urine pink, red, or brown. 5. Alcohol should be avoided while taking this medication. Rationale. Phenytoin is an anticonvulsant that can cause gingival hyperplasia, as well as bleeding, swelling, and tenderness of the gums. The client should use good oral hygiene and gum massage and have regular dental checkups. Alcohol interferes with the absorption of phenytoin, so it should be avoided. Change in the color of the urine is a normal reaction. A sore throat, fever, glandular swelling, or any skin reaction indicates hematological toxicity and needs to be reported. 30. Ritonavir is prescribed for a client with active Mycobacterium avium complex, MAC, disease and tuberculosis. For which side and adverse effects of the medication should the nurse monitor? Select all that apply. 1. Signs of hepatitis 2, flu-like syndrome 3, low neutrophil count 4, vitamin B6 deficiency 5, ocular pain or blurred vision 6. Tingling and numbness of the fingers. Answer. 1. Signs of hepatitis 2, flu-like syndrome 3, low neutrophil count 5, ocular pain or blurred vision. Rationale. Ritonavir may be prescribed for a client with active MAC disease and tuberculosis. It inhibits mycobacterial DNA-dependent RNA polymerase and suppresses protein synthesis. Side and adverse effects include rash, gastrointestinal disturbances, neutropenia, low neutrophil count, red-orange colored body secretions, uveitis, blurred vision and eye pain, myositis. Arthralgia, hepatitis, chest pain with dyspnea, and flu-like syndrome. Vitamin B6 deficiency and numbness and tingling in the extremities are associated with the use of isoniazid.